Hello everyone, my name is Heather Norton and I will be sharing with you my research proposal on the use of somatic experiencing for the treatment of combat-related PTSD. According to Hagen et al., previous research for the treatment of combat-related PTSD has primarily included traditional interventions such as exposure therapy. Due to the risk of re-traumatization and negative impact on retention, some researchers, such as Markowitz et al., have found traditional treatments to be ineffective. Unlike standard interventions, somatic experiencing is a gentle, body-based approach for the treatment of trauma. According to Brahm et al., somatic experiencing has shown promising results with the general public for the reduction of symptoms of PTSD. While studies such as these confirm the efficacy of somatic experiencing, further studies are needed in order to assess the efficacy of this treatment with specific populations, such as combat veterans. The purpose of this proposal is to close the gap in this area of research by exploring the answer to the following question. Is somatic experiencing an effective form of treatment for the reduction of PTSD symptoms in combat veterans? The hypothesis in this proposal states that statistical differentiation between the scores of the two groups, treatment, somatic experiencing, and non-treatment control, will ultimately confirm the efficacy of this intervention. The null hypothesis, in contrast, states that no differentiation in scores will exist between the treatment and non-treatment group. The design of this proposed study is a pre-test, post-test control design. The study will include non-probability sampling, and recruitment will take place through the local VA hospital in Hinesville, Georgia. Study participants will include both male and female combat veterans between the ages of 18 and 75 who have been clinically diagnosed, according to the DSM-5, with combat-related PTSD. Participants' level and severity of PTSD symptoms will be measured using the clinician-administered PTSD scale, also known as CAPS, before and after the completion of the study. Able to diagnose all 17 symptoms of PTSD, the CAPS assessment, according to Brahm et al., is considered to be the gold standard in PTSD assessment and is frequently chosen for studies involving veterans. In order to calculate the severity of PTSD symptoms, the pre- and post scores from the CAPS assessment will be summed in order to determine symptom frequency and severity. Data analysis will then be calculated through a paired t-test, as comparisons of the test scores will be analyzed prior to and upon completion of the study. Contributions to the field of counseling as a result of this study include widening the list of recommended treatment options, which will in turn offer veterans alternative body-based paths for healing. Thank you so much. Good night.